The first picture is showing the normal brain with the ventricular system, while the second picture is showing the enlarged head, and the ventricles are also filled with the extra fluid. The condition is known as hydrocephalus, where it occurs because of the increased CSF production, or there is obstruction in the outflow of the CSF, or there is impairment in the absorption of the CSF. So it is related with the ventricular system. Now today we are dealing with one of the ventricle that is known as a fourth ventricle. Myself, Dr. Sarika presenting the lecture on the fourth ventricle. Objectives of today's lecture are: we have to see the location of fourth ventricle, its walls, its relations, and the applied importance of the fourth ventricle. It is the cavity of the hindbrain which is located in between the pons and the upper part of the medulla, which is lying anteriorly, while the cerebellum is lying onto the posterior aspect. It is having the lateral boundaries, it is having the roof, floor, and a cavity of the ventricle. The lateral boundaries are formed by superior cerebellar peduncles onto the superolateral aspect, while inferolaterally it is bounded by a gracile tubercle, a cuneate tubercles, and the inferior cerebellar peduncles. So superolaterally it is bounded by superior cerebellar peduncle, while inferolaterally gracile tubercle, the cuneate tubercles, and the inferior cerebellar peduncle. Floor of the fourth ventricle, as it is rhomboidal in outline, it is also known as a rhomboidal fossa. It is formed by the posterior surface of the pons and the posterior surface of the upper open part of the medulla. Now it is having the upper triangular part or lower triangular part and an intermediate part which is extending over the inferior cerebellar peduncles. Now details of the floor of the fourth ventricle, it can be asked as a short note. So this figure is very important. A dorsal median sulcus, it is known as a rhomboidal fossa as it is rhomboidal in outline. A dorsal median sulcus divides the floor of the fourth ventricle into two symmetrical halves. This is extending from the cranial angle to the caudal angle. Now another sulcus that is known as sulcus limitans, it divides the each half of the fourth ventricle into median and a lateral area. The median area is known as the median eminence, while the lateral area is known as a vestibular area. The sulcus limitans is having a surface depression that is known as a superior fovea. Now opposite to that of the superior fovea medially into that medial eminence there lies a prolongation that is known as facial colliculus. It is formed by the arched fibers of the motor nucleus of the facial nerve around that of the abducent nucleus. Now the sulcus limitans gets flattened out onto the superior part and forms a bluish grey area that is known as a locus ceruleus, which forms the which part of the reticular formation. Then it is rich in noradrenaline and it is may be related with that of the paradoxical sleep. The sulcus limitans, it forms another depression onto the caudal aspect that is known as the inferior fovea. Now the inferior fovea onto the medial side, it forms a triangular area that is known as a hypoglossal triangle, where lies the hypoglossal nucleus medially and a nucleus intercalatus laterally. While opposite to that of the inferior fovea laterally, this area is known as a vestibular area, where lies the superior, inferior, medial and the lateral vestibular nuclei. Now below the inferior fovea, in between the hypoglossal triangle and the vestibular area, there lies another triangular area. This is known as a vagal triangle, where lies the dorsal nucleus of the vagus. Now an ependymal thickening that is known as funiculus separatus is present in between that of the vagal trigone and the area postrema. Now the area postrema, it is rich in a neuroglial and a neuronal tissue which is devoid of the blood-brain barrier, as well as the electrophysiological studies show that this area is related with the vomiting center and a respiratory center. Each inferolateral margin of the ventricle is marked by a narrow white ridge known as tinea. So you can see here that each inferolateral margin of the ventricle is marked by a narrow white ridge that is known as tinea. The right and the left tinea, they meet at the inferior angle that is known as obex. So itself it is denotes that the inferior angle of the ventricle. Roof of the fourth ventricle, it is diamond shaped in outline and it is having the superior part and the inferior part. The superior part of the roof is formed by the superior cerebellar peduncles and the superior medullary velum. The superior cerebellar peduncles, they extend from the white matter of the cerebellum. They forms the lateral boundary of the ventricle and reaches at the inferior part of the inferior colliculi, where they converge, and a superior medullary velum, which is formed by nervous tissue. It covers the superior part of the roof of the ventricle, where it is related with the lingula of the cerebellum. Inferior part of the roof, in its most of its extent, formed by a non-nervous thin sheet which is formed by the ventricular ependyma and a double fold of the pia mater. Now caudally, the continuity is broken down because of the presence of the median aperture through which the ventricle communicates with the subarachnoid space in the region of the cerebellomedullary system. The inferior medullary velum, it forms a small part of the roof in the region lateral to the nodule of the cerebellum. Some books mention that whole of the inferior part of the roof, it is covered by the inferior medullary velum. Now moving on to the tailor choroidea of the fourth ventricle. These are formed by the double layer of the pia mater, which occupies the interval between the cerebellum and the roof of the fourth ventricle. Its posterior layer it provides a covering of the pia mater to the inferior vermis, and after covering the nodule it is reflected ventrally and caudally in immediate contact with that of the ependyle. So it covers the posterior layer of it, covers the inferior vermis. As it reaches the nodule, it reflects from it onto the ventral and the caudal aspect. The telachoroidea with vascular fringes covered with that of the secretory ependyma, this constitutes the choroid plexus. Now the choroid plexus is related with the production of the cerebrospinal fluid. Choroid plexus of the fourth ventricle, they project into the lower part of the roof of the ventricle. Now each choroid plexus is having a vertical limb and a horizontal limb. The vertical limb is lying next to that of the midline, while the horizontal limb they extend into the lateral recesses. The vertical limbs they lie side by side, so a T-shaped structure is formed by that of the vertical limb and the horizontal limbs. The vertical limbs they project into the median aperture and reaches the subarachnoid space, while the lateral ends of the horizontal limb they reach the lateral apertures. The arterial supply of this plexus is from the posterior inferior cerebellar arteries. Moving on to the communications of the fourth ventricle, superiorly it communicates with the cerebral aqueduct with the third ventricle, while inferiorly it communicates through the central canal. Openings in the roof of the fourth ventricle, these are lying in the lower part of the roof. There is a median aperture, that is foramen of Magendie, which communicates with the subarachnoid space in the region of the cerebellomedullary system. The lateral apertures they communicates through foramina of the Lashka with that of the subarachnoid space. Superior angle of the ventricle, it is continuous with the cerebral aqueduct, while the inferior angle is continuous with the central canal. Lateral angles they extend towards the inferior cerebellar peduncles. Now moving on to the recesses of the fourth ventricle, it is having 5 recesses, 2 lateral recesses, 1 dorsomedian recess and 2 dorsolateral recesses. The lateral recesses they are lying between the inferior cerebellar peduncle ventrally and the peduncle of the flocculus laterally. The median dorsal recess it extends into the white core of the cerebellum and it lies cranial to that of the nodule. The dorsolateral recess it lies dorsally lateral to the nodule and lies cranial to that of the inferior medullary velum, and these are lying on the either side of the median dorsal recess. These are nothing but the extensions of the ventricular cavity. Moving on to the applied importance of the fourth ventricle. As the vital centers are present in the vicinity of the fourth ventricle, an injury to this area might be fatal. Infratentorial brain tumors, they block the foramina that will lead to the raised intracranial tension manifested by the vomiting and the papilloedema, etc. Locus coeruleus, it integrates the sensory information to modulate the arousal and the memory functions. The area postrema, considered as a vomiting center. Hydrocephalus, it is a condition where the ventricles they are filled with the extra cerebrospinal fluid and there occurs a ventricular dilatation. This might be occurred due to the increased production of the CSF, or there is obstruction to the outflow of the CSF, or there is impairment in the absorption of the cerebrospinal fluid through the arachnoid villi. In case of the obstructive type of the hydrocephalus, there is obstruction or there is block in the openings of the ventricle. It might be at the cerebral aqueduct or the interventricular foramina or in the openings of the fourth ventricle. Just to summarize, we had seen the details of the fourth ventricle, its boundaries, then the roof, floor, its relations, and the applied aspect of the fourth ventricle. The textbook of neuroanatomy BDC and the textbook of interpacing neuroanatomy, these are references for today's lecture. Thank you.